Well, it's time for our Africa 54 Health Report. Joining us now is health correspondent Linord Moudou. Hello, Linord.
Hello, Vincent. Hello, everyone. While tackling the HIV/AIDS epidemic around the world has been a great challenge for patients and experts over the years, medical researchers say the AIDS epidemic has had a harsher effect on children, especially in developing countries. In its latest report, Towards an AIDS-Free Generation, UNAIDS say in 2012, 260,000 new HIV infections occurred among children 14 years of age and under in low and middle income countries. About 39% of children had access to HIV testing within the recommended 2 months of birth. And when it comes to treatment, well, 34% of children received the life-saving antiretroviral treatment they needed versus 64% of adults. UNAIDS says without treatment, 1/3 of infants living with HIV will die before their first birthday, and half will die before their second birthday. Joining us in the studio for more on the subject is Dr. Christian Peter, Director of Global Technical Policy with the Elizabeth Glaser Pediatric AIDS Foundation, EGPAF. Dr. Peter, welcome to the show.
Thank you for having me, Linord.
So the report clearly shows that there are still some challenges there, but it also talks about some improvements that have been made, such as the prevention of mother-to-child transmission that has increased over the years. But it seems like there is not enough emphasis that is being put on children that are actually infected when they are born. What do you make of that? What is your take on this?
Well, Linord, I think it's very important for us to recognize the incredible achievements that we've gotten over the last handful of years on pediatric HIV in terms of prevention. As you pointed out in your statistics, we've seen dramatic decreases in the number of newly infected children with HIV. In fact, if you go back to 2005, about 50% of the number that were infected in 2005 were infected in 2012. So we've seen a dramatic decrease, and we need to keep going on that.
Sure.
But it's critical for us to recognize that and build on that momentum. However, as you point out, it is also the challenge that we've seen where children who are infected with HIV are not getting the care that they need.
Exactly. What do we do with these children?
Yeah.
What is being done?
Yeah. Well, let me actually point one thing out before I get into that,
Okay.
which is that if you look at the proportion of adults who need treatment that are getting it,
Yes.
about 2/3 of adults are getting treatment, and that's tremendous and that's wonderful. However, only about one third of children who need treatment are
Yes.
getting it. And a colleague of mine mentioned this analogy that how can the adults eat when the children go hungry?
Absolutely.
And in this case, we really must change our orientation so that we can get more children on treatment.
So what are the main issues here? Is it the fact that policymakers don't see it as a priority, or is it the access to the actual drugs that seem to be the problem? What are the main issues?
It's a combination of issues.
Okay.
And political
Awareness, perhaps?
well, it's political awareness, political will
Okay.
is absolutely a part of this. And in fact, we had a tremendous event in December last year where we had 8 ministers of health in an event that was co-sponsored by the World Health Organization, UNAIDS, and the Elizabeth Glaser Pediatric AIDS Foundation, the organization
Sure.
for which I work, where these health ministers endorsed, in principle, dramatically scaling up pediatric treatment
Okay.
in 2014 and beyond.
Okay.
And so that's a first step
Okay.
with regard to that. However, getting palatable drugs for
Yes.
children
Yes.
that they can take,
Yeah.
because it's going to be lifetime treatment for children who will need drugs for their disease.
Because some critics say, quickly, because we're running out of time, some critics say there is a need for a new generation of drugs for children. What do you think of that?
Yes,
Very
absolutely.
quickly.
Absolutely. In fact, many of the drugs that currently exist for children require cold chain, so they must be refrigerated. They don't taste very good, and it's hard to get children to take them. And so getting to that next step where we have drugs that are available for children that they can take easily for a lifetime of health is critical next step for us to do.
Very critical. Dr. Peter, thank you so much for joining us today.
Thank you for having me.
And that's our Africa Health Network report for today. For more health news and development, be sure to visit our website, africahealthnetwork.com.